Good morning, everyone. My name is Tessa, and today we will be discussing a current and significant global health issue, polio, specifically in Pakistan. This topic is not only to raise awareness of it, but to also focus on its importance to healthcare professionals, notably nurses who play a vital role in implementing infectious disease practices and controls. As mentioned, our health concern is polio. The article chosen is called Will Pakistan Ever Be Able to Eradicate from Polio from Al Jazeera News. The Al Jazeera news source states, Pakistan is one of the only two countries in the world where polio is still endemic, the other being neighboring Afghanistan, according to the World Health Organization. Multiple setbacks have occurred in the overall eradication of the disease. The article focuses on the political challenges, misinformation, and fear of the vaccine, which adds to its deadly existence in the country. The frontline workers in this battle are the healthcare professionals, especially nurses, in the campaigns to help vaccinate children. The article reveals that the healthcare workers have been facing countless threats of harassment, threats, and overall violence. This points out that dangers healthcare providers face when aiding in infection control. Nurses need to understand the perspectives of the community to be able to erase the false ideology and misinformation around the polio vaccine in Pakistan. Al Jazeera informs us that the misinformation that is highly prevalent in rural communities adds to these challenges for healthcare workers. Nurses and other health providers must play a crucial role in being practitioners, educators, advocates, and leaders for these communities. Health professionals provide beyond medical aspects and can truly make a difference in the future to help eradicate all diseases.
My name is Madison, and I'll be presenting our articles. And our selected articles expand on polio nursing as well as polio in Pakistan. Nursing implications regarding polio will be further discussed later in the presentation. Focusing on the article, Achieving the Endgame, Employing Vaccine Diplomacy to Eradicate Polio in Pakistan. Polio is explored in Pakistan and the history of it in the country. Poliomyelitis, also known as polio, is a viral infection through the oral fecal route with 3 serotypes, including wild poliovirus type 1, type 1 circulatory vaccine-derived poliovirus, and type 3 circulatory vaccine-derived poliovirus. Polio is a preventable disease, and there are 2 available vaccines for prevention, which are OPVs, oral poliovirus vaccines, and IPVs, inactivated injectable poliovirus vaccines. Polio has been eradicated in all but 3 countries, which are Pakistan, Afghanistan, and Nigeria. Pakistan has had increased efforts since 1970 to eradicate polio. The NEP, National Emergency Action Plan, was developed in 2016 to 2017 to eradicate polio transmission through communication, cooperation of multiple stakeholders, and committed efforts. However, the efforts to implement NEP were impacted by military missions, immunization bans, and immunity gaps. In 2011, there was a lot of mistrust in the health sector as the CIA had funded a fake vaccination program in Pakistan to garner information to find Osama bin Laden. Therefore, the idea of vaccine diplomacy has been introduced, which is a branch of global health diplomacy that promotes vaccines for the greater good of the human population. Vaccine diplomacy promotes vaccination in low to middle class communities and addresses healthcare accessibility.
Hi, my name is Chloe and I was speaking about the philosophical approach. After reading the selected articles, the 2 ideas that were presented were critical social theory and social justice. The study of critical social theory focuses on how power relations and societal institutions affect problems and health inequities. Due to the economy in Pakistan, marginalized rural communities frequently lacked access to healthcare facilities in comparison to urban neighborhoods, which impacted their ability to receive polio vaccinations. According to the article, most polio cases occurred in federal administrated tribal areas near the border area with Afghanistan. These high-risk regions were heavily influenced by political instability, security hazards, low literacy levels, and local religious beliefs, which complicated the elimination of polio and vaccine distribution. Correspondingly, in certain parts of Pakistan, opposition to the polio vaccine increased after a historical misuse for political and military purposes, such as the US CIA using a fake hepatitis B vaccination program to locate Osama bin Laden in 2011. This relates to social justice as well because it emphasizes how crucial it is to inform those who are not aware of polio and guarantee that all communities have equal access to health care. Critical social theory allows us to understand the cinematic elements such as regional inequities and social political history that contribute to the ongoing epidemic of polio. While the social justice approach emphasizes the importance of equitable access and rights to overcome polio, these theories help identify areas that require fundamental changes as well as promote immediate measures to improve healthcare availability and offer appropriate education to reduce vaccine hesitation. These two methods, however, run the risk of limiting the discussion by concentrating too much on examining structural causes while neglecting fundamental problems or overlooking the underlying issues.
Hi, my name is Amber, and I'll be speaking on the cultural considerations. In the federally administered tribal areas of Pakistan, adult males are far more literate and educated compared to adult females. According to the article, Achieving the Endgame Implying Vaccine Diplomacy to Eradicate Polio in Pakistan by BMC Public Health, the federally administered tribal areas in Pakistan have a much lower literacy rate compared to the nationwide average of Pakistan. This is due to the high amounts of violence and destruction of schools. This makes it difficult for citizens in this area of Pakistan to understand health professionals and campaign staff communicating their messages and strategies on polio. According to the news article, Will Pakistan Ever Be Able to Eradicate Polio? A study explains how the fathers of these areas of Pakistan are usually the decision makers, which means the father decides whether their children should get vaccinated. With both parents being more educated on the health and attending interventions on the importance of getting vaccinated, can prevent the increase of polio in these areas of Pakistan. Another cultural consideration to consider is the religious beliefs of citizens in Pakistan. Many citizens in Pakistan follow Islam as their religion. Some problems that the polio campaign faces are the high amounts of misinformation from the government and myths that citizens have been hearing about the vaccine carrying evidence of alcohol and pork. As alcohol and pork are prohibited in Islam, this makes citizens of Pakistan believe that the vaccine is sinful, which will end up having citizens from Pakistan to refuse the vaccines for their children.
Hi, my name is Aisha, and I'll be discussing the nursing implications regarding the polio cases in Pakistan. So historically, nurses have played a very important role in care for polio patients before vaccine availability. The nurses provide essential support to the patients who are suffering from severe symptoms, particularly during respiratory crises like difficulty breathing, as well as orthopedic challenges such as mobility issues and muscle weakness. Nurses were found in building trust with patients. Nurses were focused in building trust with patients, which was an essential part of successful treatment outcomes. In order for patients to understand the treatment goals and feel continuously supported by their healthcare team, communication was an important part implemented. Better patient outcomes and treatment commitment are created by this trust built with the nurses. Next is personal values and professional values. For personal values, empathy and compassion is needed for nurses to be able to relate to patients on an emotional level and support them through difficult situations, particularly when it comes to illnesses like polio that have both psychological and physical effects. Next is integrity. Communities who are hesitant about vaccinations will become more trusting if treatment plans and possible vaccine side effects are kept open and honest, especially in places where vaccine misinformation is common. For professional values, advocacy is there. Nurses are responsible for advocating vaccinations and their importance for public health. This would regard the nurses to educate patients about vaccine safety and importance, as well as eliminating any myths surrounding vaccinations. Next is commitment to lifelong learning. Understanding the history of polio and advancements in care can enhance a nurse's effectiveness. According to Pattison, nursing education regarding polio was critical for providing competent care during epidemics, which can be applied to future situations like COVID-19, for example. Next is how we can implement DIPS into this. For diagnosis, you would assess the needs and concerns of polio patients and their families. This would include evaluating their understanding of vaccination and their previous experiences with healthcare providers in case they had any bad ones from beforehand. Try to recognize any barriers that the individual may face regarding vaccination, such as misinformation or distrust of health professionals. Next is interventions. Implement educational programs to address vaccine misconceptions. Nurses can engage parents with clear evidence-based information on vaccine safety and effectiveness. Use the community to involve local leaders and strengthen vaccination campaigns. Next is planning. Create personalized care plans for polio patients addressing both physical and emotional needs, and begin to think of ways to implement strategies for potential post-polio symptoms. And lastly, support. Advocate for improved access to healthcare resources in unreserved communities. Recognize the impact of social factors of health on vaccine accessibility. Provide education and support for healthcare professionals regarding the long-term effects of polio and post-polio syndrome, ensuring they are ready to deliver quality care to patients.